You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. Oral health has a significant impact on overall health because the mouth is both a gateway to the body and an integral part of the body's systemic functions. Poor oral health can contribute to or exacerbate various health conditions like heart disease, diabetes, rheumatoid arthritis, and create pregnancy complications. So good oral hygiene practices and regular dental checkups that can improve oral health are very important for our well-being. To help us understand more about this, our guest today is Dr. Arti Jagirdar. Dr. Jagirdar has been practicing dentistry in New York City since 2011, and she is on a mission to redefine oral health as the gateway to overall well-being. As the visionary founder of Flatiron Dental in New York City, Dr. Jagirdar focuses on holistic patient care while educating and promoting the vital connection between oral health and systemic wellness. Seamlessly blending her passion for dentistry and art, Dr. Jagirdar gratefully embraces the chance to positively impact and improve her patients' lives. We extract a lot of information in this interview today. We talk about how systemic health is impacted by oral health, significant oral indicators or specific oral indicators that might suggest the presence of other health issues, and how oral health can impact cognitive function. Do stay tuned with us. We will be back in just a few minutes to talk to Dr. Jagirdar.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub, everybody. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on those locations. I apologize, X and Facebook, and we are at the Health Hub RMC on those locations. Dr. Jagirdar, welcome to our show.
Thank you for having me, Kathy. It's great to be here.
We have had dentists on, integrative health specialists that explore the dental area. Obviously, this space in health is taking up more and more bandwidth. And, even in my own practice, I have a component of my intake form that deals specifically with oral health, routine, and all of that. So this is a topic that, we need to keep revisiting to see where we come, what is new, more connections that we can make. So thank you for coming to the show and helping to elucidate dentistry and integrative dentistry and why it is important for our health. How did you get into this space?
I have been a dentist now for almost 16 years, and in that time, going through my own health hurdles, watching my patients and being able to address their needs, I realized that I needed to get deeper. And as you keep going deeper and see all the connections, I think it was just this exploration of my own curiosity on behalf of my own patients of, how can we do what's best by them? I'm also informed by my own culture. I was born in the United States, but as a child of Indian immigrants, and I found a lot of healing with an Ayurvedic practitioner. So I am definitely very much a science-based practitioner. However, I I never try to shy away from using modalities that could really help our patients. Very low cost, oftentimes, not invasive, and we can help people live a better life by being a bit more thoughtful, I think.
Well, what is the impetus that caused you to go deeper? Were you feeling that you weren't treating your patients as well as you could? Were they asking you for advice? What is all of a sudden that light goes on that says there's something else in dentistry?
I don't know. I'm gonna tell you, I don't know if it's nature or nurture. Being born to enterprising immigrants, being raised in an environment that was just like you shoot for exceptional. Why not you go out and do good work? So I've always sort of been of this mind that I always wanted to be the best that I could possibly be. Right out of residency, I invested in the best continuing education. I spent at that time, the first 2 years out of residency, almost $50,000 on courses with Dr. Frank Spear, who's in Scottsdale, Arizona, a really wonderful restorative dentist. I'm now finishing Dr. John Coyce's courses in Seattle. They are from the same sort of like vein of knowledge. And I've been looking at the University of Arizona, Andrew Wiles' and integrative medicine course now. So I would say that it started, I think I'm just the kind of person that, I was running marathons and climbing mountains, and I was always going to be the kind of dentist that was like, how can I do this as best as possible? What technology is available to me? How can I really take care of these people? And then informed by my own health journey. I think there are so many dichotomies in life. For me, I had mitral valve repair in 2019, open heart surgery. I've just finished breast cancer treatments, been doing that for the past 8 months, and I'm good now, but I bring the knowledge of my own experience to what I do. And so having a great deal of compassion in this space, knowing how one part of the body can impact another, and really taking a stand for that, even if it's against the grain a bit, I'm not easily shaken given my experience. So it can be a bit of an uphill battle. It's not where dentistry necessarily is. I think all providers are well-intentioned. I would, like everybody wants to do a really good job, but there's a lot of factors at play that kind of keep us as dentists from being able to pursue that.
Well, your story certainly resonates with me. And if we can use our health journeys, our health struggles, our health enlightenment to help other people. And, I'm always of the vein that, if we tell our story, someone might have the right question to ask so that they can prevent, or they can seek, or they can find out more. And it's not an easy thing to do sometimes. I don't know if you're the same as me, but I feel the more I tell my story, the easier it is to speak about it. And hopefully you're the same way about it, because I do think it makes a huge impact on people. So, I think it's very brave of you to talk about what you're going through. So I do appreciate that.
I'm practicing here with you now. I would say
absolutely.
I was just I think when you're in the weeds, there's not much to say. And so now that I'm gaining a little bit of distance, hopefully I'll have some more to share that's, less than just like, well, this is really terrible. I don't, there's some wisdom that was,
you're in the health field.
Yeah.
Nobody is protected with perfect health within the health field, we all do our best. I'm always of the thought that, we all are going to have some weaknesses. How they manifest, will be different for everybody else. But no one is protected from having health issues. So I think that just by saying that you're in the medical field, you've had issues that you have dealt with and are dealing with, and that's life. I think that is just so compassionating, if that's a word, but it will give other people the sense of, hey, I'm not a failure because I have a health issue. Many, many people go through it. And I think the more we share our story, the more compassionate a world it would be. So a little bit of an aside, but I truly admire what you're doing in that area. Back to dentistry. Yes. What is restorative dentistry versus every 6 months dentistry?
Yeah, I mean, if somebody has healthy teeth and all they need is their regular cleanings, even when they show up for their cleanings, there's barely any buildup. I mean, I have a couple patients where I'm like, you could come once a year, you're doing great, you know? But once we have lost any kind of tissue in the oral cavity, is it something that's going to need to be replaced? To what degree will it be replaced? And how do we prevent future loss? And so to be a restorative dentist, you keep looking increasingly outward. So when we're first trained in school, it's like, how do you do a filling really well? How do you make it look good? How do you make sure food doesn't get packed, that is bonding properly? And now I'm at the point where I rebuild entire arches. So somebody could come to me with a joint issue with broken down teeth, and I'm able to give them back, their full bite in a way that's very balanced for their joint, making as much space for their tongue in their mouth as possible to keep their airway a bit open. As I keep going outward more and more, I just started to include salivary testing. Part of my work is, the foundation of any of the restorative work I do is periodontal condition, is the gum and bone health. And there are certain bacteria that people are more inclined to have infections with that are far more pathogenic. And there are also people who are much more responsive. They have the cascades of enzymes are so much more aggressive against these bacteria versus somebody who might not have that genetics, who could have the same bacteria in their body would be like, you know what, that's fine. It's just going to chill there. So I'm starting to get into more and more. How do we really treat that bacteria and change the oral microbiome? I have a lot of patients that come to me and they start with carie-free treatment rinse. It's a mouthwash that has a pH of nearly 12, and it's meant to kill almost all the bacteria in the mouth, leave behind a very alkaline state. It allows us to promote more of the beneficial bacteria and support those, rather than allowing the more harmful pathogenic bacteria to take hold. So that really, that foundation to me is one of the biggest entry points for dentistry as it relates to overall health. I think cardiologists should have a dentist that they refer to, certainly anybody in orthopedics, surgeons. I do those clearances, but sometimes it's like, well, I've just met you, you need to have a dental home where somebody's really watching these things. I've had referrals from OBs where young women don't don't realize how important it is to have good gum health. If you have periodontal disease during pregnancy, it can lead to a early labor sometimes, a low birth weight child sometimes. I've had referrals from rheumatologists. Periodontal disease causes a great deal of inflammation that can worsen joint inflammation. The inside of the mouth looks like the inside of the gut. Once I get started, I won't stop. So I'll pause there because I feel like I'm just dumping a lot of information on you. But it connects to everything, right? It's the gateway to the body.
No, and that's important to note. And again, referring back to when you're speaking of the saliva test kit, we recently had Dr. Patty Milligan on our show, who is very knowledgeable, and this is her area of expertise, is saliva and saliva health and tooth health and gum health. So, all these things, I think we take for granted until things go awry are so important to put in front of people. When I'm working with cancer patients that are going into chemotherapy, I always recommend that they see their dentist ahead of time, so that they can get their oral biome in shape, the oral cavity in shape as best as possible. Because as you say, every aspect of health, and it's good to hear that you've got cardiologists recommending back to you too, because everything fits together. I too recommend a cardiologist when patients are going through chemotherapy and post treatment, always have that person in your back pocket. So the fact that you're getting recommendations and it just seems that the whole body is being treated now, and we're coming a lot more to that understanding.
Yeah, absolutely. And I do, I opened my practice about a year ago, and I'm just now starting to get my feet back under me. So the goal really is to increasingly build that team. I have a lot of medical doctors that I work with. I'll give you an example of something that I was able to diagnose. Anybody that comes into my practice as a new patient, we spend anywhere from an hour and a half to 2 hours with them, just getting very good baseline records. And I tend to be quite conservative in my approach to treatment. And it's all about educating the patient, allowing them to advocate for themselves, building value for the difference that preventative dentistry and kind of a higher level of care can be. As I am creating partnerships with the different medical providers, sometimes you got to find like somebody very, very specific. I had a patient who came in, she had pain in the back of her tongue, sometimes with swallowing, it would come and go, sometimes in her ear on the left side for years. And she had gone in multiple ENTs, had gotten an MRI, nobody had any answers. And on my CBCT, on my 3D imaging, I could see that her stylohyoid ligament was calcified. It goes from the base of the skull, kind of right behind the ear, to the hyoid bone at the front of the throat. And if it gets tightened, that ligament, it can pull on the bone and cause the symptoms that she was noticing. And so I was able to palpate that tendon, loosen it a tiny bit. And she was like, that's exactly what hurts. And it made a tiny, tiny bit of a difference. So then I had to, find who is the person that can access base of skull, like, and have this conversation with me where I know that I can send them this imaging and it's going to be like a texting relationship. So I'm looking forward to, I do think it takes me a decade and a half into practice. I can have so many more of these conversations with very, talented providers to build a team. So that's what I've been working on. I have a lot of great people that I send many of my patients to, and hopefully it becomes more accessible for people. That's really what keeps coming to mind, is it currently it's not easy for people to invest in this level of healthcare. It's not cheap for us to provide this level of healthcare. So that's a larger conversation.
Now, you have doctors that you recommend, or that are recommending you to. Are you in a position to diagnose or to say to your patients, or is this even a thing? You're working on your patient and you say, I think maybe you should think about visiting a cardiologist for XYZ. Does that make sense in your area?
Absolutely. Yeah, absolutely. I mean, where I start, like as a general dentist, we're the quarterback of your dental care. If I have to send you off to anybody, I'm holding the strings of that story together. And in the same way, I really do want to start with their primary care physician. And I don't want to overstep, because their primary care physician really should be the one that's quarterbacking all of their overall healthcare for them. So there are times when they have like, oh, I go to somebody at the big hospital, they see me for 15 minutes, I've been struggling with this thing or that thing. And, a lot of my patients are my age, we're perimenopausal, and they're not having conversations about hormone replacement. And they're like, do you know anybody who does that? Right. And so I encourage patients to first find that primary care physician, because I'm not going to be able to quarterback to all the specialists. I really need them to work with that medical practitioner who can be my partner in helping them find that. And I have people who are really wonderful who do that kind of work, who are, they trained at the University of Arizona in Andrew Weil's clinic. They have very small practices and, very old fashioned sort of like one-on-one, lots of time together practices. So I am very mindful of practicing within the scope of dentistry. And I'll say, this is something that I notice. This is my experience of what sometimes it could be. I'd really love to make sure, I'm not there to diagnose anything outside of what I'm able to, but I also know that we sometimes see a lot. We see patients more than they see their primary care physicians. We're looking in the back of their mouth more than primary care physicians are. Sometimes no one else is looking in the back of their mouth, into their throat, into their airway. So I just try to advocate for them to go on to that next step.
Within your scope, are you able to diagnose anything outside of dentistry, or you must stay within that lane?
I really do feel like we owe it to our patients to stay in our lane.
Okay.
I think, I treat, for instance, sleep disordered breathing. Patients will ask me about mouth taping. I encourage them to see an ENT first. Why aren't you breathing through your nose? Do you get congested at night? To put tape over your mouth could cause apnea, hypoxia overnight, and cause cortisol levels to strike, could cause your, heart rate to increase. That's very stressful for the cardiovascular system. And you think, well, I'm promoting nasal breathing, which is great, but it's like, well, let's make sure that you can, or I do a lot around sleep medicine. We made a lot of night guards. People are clenching, grinding, breaking their teeth. Well, why is it happening? A lot of times people are deprived of oxygen. Their tissues are collapsing in the back of their throat. And in the same way, I want them to get a proper sleep study. I know how much it took for me to have my expertise. know that there are others, I know them, who have a level of expertise in their areas and that I could never match. I think I'm a great entry point, right? To like have that conversation with the patient, introduce them to the people that can help us. And then if they, for instance, somebody might have mild sleep apnea and they're coming back to me for their oral appliance, or they have severe sleep apnea and an oral appliance helps them use their CPAP with less pressure. Or some people leave it on their nightstand night after night. I would much rather they have the oral appliance than not have their CPAP at all and not wake up in the morning, of course. But I want us to always start with that high level provider who has that specific training. I know what I know very well. I don't pretend to know what all of these medical doctors know as well as they do.
Well, it's funny, not funny, but it's not coincidental that the dentists that I speak to, that I've interviewed, are being approached more and more frequently with issues of sleep deprivation. And it almost seems that heading to the dentist these days is the place you go if you want help with your sleep at night.
Yeah, no, it's true. And there are, it's in New York State, I could have a sleep test mailed to their home. A physician could sign off on it. It just doesn't equate the level of care. Like that person might need to go to like a hospital stay overnight to really get their sleep study. They might not put the cannula on right at home. So I would rather really in New York, technically a medical doctor should be prescribing the sleep study, should be prescribing the treatment for sleep apnea. And I don't like, of course, red tape. Like I'm not trying to be purposely obtuse when I do these things. I just want to make sure we're taking care of people properly. So I know as much as I do from where I look. Like I'll tell my Invisalign patients there's a type of crowding in the mouth called an omega arch, where in the middle of their smile, their premolars, their canines, sometimes they dip in and they just sort of crunch in. And so if we round out that arch, their tongue has so much more space in their mouth. And I'll point to them on the CBCT. It gives me this volumetric scan that looks really scary because it goes from reds and oranges to blue. So we can really, it's not necessarily diagnostic, but it's incredibly illustrative. So there are no studies that say doing orthodontics will treat sleep apnea, but I know that creating more space in their mouth for their tongue will free up their airway. And then we're going to talk about sleep position. We might send them to a physical therapist to make sure that their head posture is correct. I might, I talk to them about where their tongue should be sealed against the roof of their mouth and the way that we want the muscles underneath the base of the mouth and the floor of the mouth to be stronger to help support an airway. As I grow my practice, I would love to bring in myofunctional therapy. I talk about, tongue tie releases. A lot of the really tight tongue ties are retrognathic people where their lower jaw has been pulled in because of this very tight tongue tie that they grew up with. It's like a rope that just limits the growth of that jaw. My daughter, hers is in Invisalign now. People are like, how can you get a 7-year-old to do Invisalign? I was like, I have friends who've done it on 3-year-olds. You'd be surprised. So that's a reflection of our diet. And this is me as a dentist knowing as much as I know. My daughter ate solid foods like avocado, sweet potato at the age of like 5 months, as soon as we were told to start trying. And here I am as a dentist knowing I want her to have strong jaw muscles, a strong tongue, make sure she learns how to swallow properly. We were off bottles. We, had her drinking out of a regular cup, but it's our diet. So we're constantly fighting these so many unknown environmental factors and just kind of doing the best we can. Early intervention can lead to really great outcomes in adulthood, and we know more and more. So that would be another one of my goals is really bringing in a pediatric dentist and focusing on pediatric airway, because so much of what I see in adults, it could have been such a simple fix to guide them down a much more open path of growth. They get a little trapped sometimes. It makes sense to me, but I can talk about it more.
Well, it's such a niche area, and I have 2 little grandbabies, and I would love for my daughter and daughter-in-law to have somebody to talk to be, just alerted to the fact that these things can be so helpful. And it's very, very interesting to me, setting the stage now, obviously it sets the stage for us in adulthood, but it's not really included in what a parent has to actually go seek out the information. Whereas the more and more we go to dentists, if this was offered up, I think it'd be a great thing, a great thing. We're going to take a quick break here, everybody. We'll be back in just a couple of minutes to continue our conversation.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub. My guest today is Dr. Jagirdar, and we are talking about integrative dentistry, going down the path of a little different sort of focus than we have on other shows. We're going to talk about cognitive health and oral health, the connection between the oral health and cognitive health. But before we do, you dropped a little nugget on us that the inside of the mouth, I don't know, I can't remember if you said it reflects the inside of the gut or that it should look like.
It can look like the inside of the gut. So sometimes we'll see patients who have a lot of inflammation. We're asking them, do you think you might be breathing through your mouth? Are you, their teeth are impeccable. They're doing all their hygiene every night. Their gums are bleeding a lot. And there's a variety of things that could be. I won't say that it's always necessarily a GI condition, but I would encourage those patients to talk to their primary care, get the referral to the GI doctor. We found celiac disease, ulcerative colitis. We found that when somebody is having, really a flare of their irritable bowel symptoms, that their teeth are also starting to wiggle more. Those inflammatory processes are certainly linked and they can exacerbate each other. So the inflammation that's happening around the intestines can trigger that response around the teeth. What's happening around the teeth will cause those inflammatory factors. The bacteria that live around those teeth can travel and cause issues in the gut. So it becomes this catch-22 of a circle where we're just trying to get one to make the other better and get that cycle to go up instead of down.
In research that you've done as a science-based dentist, have you seen any indication that it can start with the oral biome and the oral biome can impact the health of the gut, especially with people that have ulcerative colitis or celiac? Can it be a positive impact taking care of the oral biome?
There's definitely a positive impact taking care of your mouth. There's more and more research that suggests that there's a gut-brain axis. As you were to look up this term, there's research recently that people have been talking about. It was just an article in Translational Psychiatry that a friend and I, who is a GI specialist in psychiatry, that we're going to discuss at further length. But knowing that the bacteria that are in your mouth can travel to the gut, can travel to the lungs, we really want to make sure that, first of all, back to nasal breathing, that we're not giving the bacteria in the mouth more opportunity than it has to travel elsewhere. There are studies that link trauma with untoward outcome. When there is more strep mutans, the type of bacteria that cause cavity in childhood, and they take over a certain percentage of the oral microbiome, a lot of people are kind of set at that percentage, and it can be a bit harder to shake that. There's more research about the type of bacteria that travel to the gut and how it could be giving a feedback loop to the brain, including links to anxiety. So I'm just starting to understand more about it, and I have a specialist coming into the practice next week. I'm going to be working closely with a periodontal specialist. I really feel strongly that having that healthy foundation is where we start in dentistry.
So we talked about the mouth, the gut, and the brain. Mm-hmm. Is there, in your opinion, an oral biome brain connection that needs to be examined more or taken care of better?
Absolutely. And that is kind of the edge of the research. There's more clinical trials happening right now that's trying to elucidate the pathways that link the microbiome to mental health. So they know sort of from anecdotal studies a bit of taking health histories and saying, okay, well, this person has needed these kinds of treatments and they're in this kind of, so it's been a bit hard to study. There's so many variables, but those studies are currently being created. And I really feel like we are at a point where there's so much more conversation around holistic health, and a generation of female providers, especially, who are taking some time to put a lot of these things together. There are, of course, amazing male practitioners too, but by and large, I have these conversations with my female colleagues, and we're putting together a story that can be quite cohesive. And these women are in places of leadership in academic institutions, and they're able to create these studies, which I'm looking forward to. It wasn't really available for a long time.
Very interesting. So to go back then to the saliva testing that you say you do, is this a routine test you do with all your patients?
I don't do it routinely. It's offered to everyone. I do it for my periodontal patients. So we have patients that, we might take the initial sort of approach, the traditional approach of debridement, of physically removing any buildup, of giving them the tools that they need. They need a water flosser, this, that. They're coming for more regular cleanings. Ideally, I'm telling that person, before we start anything, it'd be great to get this as a baseline. And I've done that a few times. And what's really fascinating is to continue to test the microbiome, because we're targeting specific bacteria. First, we very much want to work locally. It can be with, as we're doing this cleaning, sometimes we have to do a surgical cleaning. We're debriding with antimicrobial agents. We're helping the patient keep everything incredibly clean. I don't have a laser. I'd love to bring on a laser that can sort of kill anything that's living in these pockets. And our goal is to not allow an environment that can be home to these types of bacteria. They thrive in anaerobic environments. So it's our job as dentists to make sure there aren't deep pockets that they can sneak into. Every now and then we end up having to go for systemic antibiotics. There are some bacteria that will not respond without the overall antibiotics. And in that case, I want to work with a functional medicine doctor, ideally. I'd make sure that they're on the right probiotics, that we're not going to cause any kind of vitamin deficiencies as we're going through this process, and that we rebuild their gut on the other end of that. So again, it's like you open one door and there's 5 doors on the other side of it. That's what I'm realizing.
Well, if you are doing these, and I don't know how well versed you are on results, or if you get, I know some testing, they'll have somebody who tells you certain things as you're reading over the results. But as a dentist, are you looking for a certain bacterial profile? So much so that you're trying to propagate certain bacteria, negate other bacteria. Are you that specific, or are you just sort of generalizing more and more?
We are looking at specific types of bacteria. Okay. There are ones that are low risk bacteria. There are ones that are higher risk bacteria. And we can target the genetics with specific medicaments of the higher risk bacteria. And by high risk, we mean bacteria that will cause more damage to the tissues, that find their way burrowing deeper into the bone, that cause more bone loss, versus allowing the nutrients available in the mouth to be more available to the more preferential bacteria, that we're allowing the healthier bacteria to sort of crowd out and use more of those nutrients available in the mouth. It can mean that, they might need to have enough calcium. Sometimes women who have bone density concerns, that can honestly impact the story, because they're not going to have as much calcium available in their saliva. Their body is trying to save it for their bones. And so it all kind of goes together with the overall health, working with the medical practitioner, but we're really looking at the actual population, the names. I know there's a genetic test. This is the genome that was decoded. These are the bacteria. Here's how we treat it. Here's like the first line. Let's see what we're left with. And it's like I said, the first specialist I'm bringing into the office to work closely with me is a periodontist. So we're going to get, and I know there are people who have come ahead of me who have a lot more experience along this. So you mentioned a dentist who was here just before me who does this. So it's something that I'm looking to dive into more deeply. I think that it's educating patients. It's because it's so different from what they might have heard from other dentists. It's not, and it's funny, I don't want patients to think of this as like another way that dentists are trying to be profitable. That's not it at all. That would not be, there are a lot of other things that dentists can do that would be better business decisions. There's so many of us out there that are like this though, who are trying to educate, who are pushing the envelope, who are saying like this really matters. It can decrease your likelihood of heart attack, of stroke, of arthritis, of so many conditions, and creating education around it, value around what that is, allowing patients to want that for themselves. That's really part of the work. Because to tell someone, listen, can you take antibiotics for 3 weeks? Like that's, they're going to be like, well, why? Why should I do that?
Yep, exactly. Now, is there genetic testing that is relevant to oral health, or are we there yet, or does it matter?
There is. There's one that we do for periodontal health, interleukin, and there's some people, it's either a C or a G, and the C gene is, my specific to my report and how it's stated plainly, is a less responsive gene. So that gene doesn't have such a pronounced reaction to bacteria versus the G, which is going to have a very pronounced reaction. And the thing that I'm talking about, what periodontal disease really is everyone knows what plaque is, the bacteria that's on teeth. Over time, it can harden. It takes about 24 hours, maybe 48 hours, where minerals in the saliva will allow this plaque to harden on the teeth. Over time, it starts creeping underneath the gum. If we have what we call attachment loss, where now we've lost a little bit of bone, the gum is not attached where it used to be, that's what we start calling periodontal disease. And there comes a point where if it's down below the gum so deep that you can't keep it clean day to day, and even at the dentist, there are areas that are hard for us to keep clean. Now this bacteria has found a home where it can live all the time that you can't keep clean, that even your dentist has a hard time keeping clean. So I just wanted to state that in maybe more plain terms to illustrate what we're talking about, because I know that it gets more complicated from there. It's just imagine, there's this home deep down underneath the gums for this harmful bacteria, and this response we're talking about, it's our own body's immune system causing that damage. And as the immune cells come to dump out their enzymes to break down the walls of the bacteria, it's also breaking down the walls of our own cells. So that inflammation is because our immune system is provoked. Some people, again, they will have a response where their immune system is like, let it live there, not a big deal. And they won't have the damage go nearly as deeply as somebody whose body is like, we got to fight this and we got to fight it hard,
They're almost talking about an autoimmune disease.
Yeah, and I talk about the hygiene hypothesis quite a bit. My husband's family has a lot of allergies, food allergies. Increasingly in Western societies, we have a lot of autoimmune disease. I'm sure have you heard of the hookworm treatment for some of the GI conditions where somebody went and, well, I know who this person is, but he went and got purposely infested with hookworms and it cured his ulcerative colitis. Have you heard of this?
No, I haven't.
Okay, I'll send it to you. But I mean, some of the thinking is that we don't have enough for our immune systems to fight. And so it finds its own tissues and fights itself. And that doesn't mean that we should be dirtier, perhaps, but, it's like maybe the ways in which we socialize are not being so clean sometimes and making sure we have enough natural pathogens to continue allowing our immune system to fight a real pathogen versus our own bodies. And it's obviously way more complicated than that. I wouldn't pretend to know everything that an immunologist has to know, but it's been one of my experiences that it only seems to be getting worse, the autoimmune conditions.
Mm-hmm. Yep, and hitting all other areas of health that we haven't even talked about. A question I just, a long time ago or a while ago, we didn't think that the brain could adapt and change and synapses were, and the connections were set in stone. And now we know that, that's not exactly the case. Mm-hmm. And there are certain things that just stick out in my small little mind. And one is about receding gum line, which impacts so many people. Mm-hmm. And I've always been told that there's nothing that can be done for that. Is that still the case? Or to repair it, are we still talking about a pretty intense surgery?
They're getting better at more conservative surgeries, but it is surgical still for something that will last. There's something called the pinhole technique where instead of, they take the tissue locally and suture it upward and do the whole surgery through a pinhole. It doesn't have the same success rates as the traditional, taking a graft from the roof of the mouth and the whole thing. And that can be quite traumatizing. So, in my 1.5 to 2 hour exam, one of the things I'm looking at is, what is their bite like? Where is the recession? Are they brushing too hard? I keep the Sonicare Diamond Clean here. It has a pressure sensor. Do we need to get them into something that's going to teach them to lighten their grip? Are they using a medium bristle toothbrush? The toothbrushes that we give out to patients, it's like a handheld toothbrush, mechanical, is Nimbus, which has very, very soft bristles. Cocoa Floss made a very similar toothbrush. So giving patients the tools to make sure that the things that we see aren't going to get worse. When a tooth takes too heavy of a lateral force, that causes recession. So a lot of my patients are in Invisalign. My goal is to get them to something that's very stable, where we don't need to do much for life. I use a lot of SDF, silver diamine fluoride, in my practice. We can scrub root surfaces with SDF, which will help prevent cavities in the future. It really hardens the surface, can make it almost glass-like. Areas of recession are so tricky. They can be outside the line of hygiene. So if recession gets too far away from where the rest of the teeth are, like there's a big area that kind of scoops away, people aren't going to brush that high. They're just kind of, doing their thing, and the plaque sits there and gets worse and worse and worse. So sometimes it's because we want to bring it back down. And then there's this transition from the gum that's attached to the bone around your teeth, and then it transitions to the part of your lip that moves, of your cheek that moves. It's way better to do this intervention when the recession is kind of like 3-4 millimeters of recession than wait for it to get close to that border, because our graft, if it gets pulled around by this mobile tissue, it's not going to heal as well. So intervening a little bit, as unpleasant as it is, some of the more conservative treatments might be available to you if you intervene a bit earlier. That exposed root surface, especially, we talk about cancer patients, their incidence of cavities is quite high. They might not be able to eat. They might have nausea. They might not be able to brush. They have very decreased salivation oftentimes, and it can cause root cavities. Roots are much more susceptible. They require, pH barely below neutral to start softening. So there's a lot that I do for patients with different neurological disorders or through cancer treatments, to make sure that we're giving them every tool possible to mitigate any damage. Silver diamine fluoride has been incredible. It essentially freezes cavities. I floss it in between teeth for patients. We redo it 6 months later. And really, like, if I see just a baby cavity, I can get that patient to never need a filling in that tooth. Like, just keep showing up, do like one extra thing at night for me, and we'll keep things really conservative for you.
Interesting. Going back to saliva, you're just speaking about it there with cancer treatment. Radiation to the neck, to the jawline can cause saliva to not be produced at all. Some people live with this for the rest of their lives after certain treatments. Is there a product that has been tried or on the market that can replace organic saliva?
Not quite the exact mixture, right? It's like that special sauce of, your minerals, of the wetness. When it's not constantly replenished, the mouth will dry out again more. Biotene has been a very popular brand. Now, Carry Free is a brand that I like very much. They have a mouth spray that has xylitol in it. They have mints that have hydroxyapatite, which is the mineral found in enamel, in it. I work with Dr. Debbie Lee, who did a dental oncology training here in New York City. One of the great things about being in a big city is that people have specialties at hand, people who really, really know. And so I think for any cancer patient, chemotherapy can cause dry mouth, can have these changes to their diet that can be detrimental to dental health. But the head and neck cancers can be far more devastating. So anything that we might be at risk of losing in terms of teeth, we really don't want to do an extraction to a radiated bone. Like, we really have to make sure that the teeth are healthy. And if they're not, do we need to extract them? How do we fix them? And then there are patients who lose certain tissues and they have obturators where, maybe we have to create closure between the roof of their mouth and their orbit. And my colleague, Dr. Lee, there are people out there who will service those prosthetics and keep people very, very healthy. So I take care of a lot of cancer patients at my level, but even above me, there are people who are highly skilled at caring for people long term following these kinds of illnesses.
Would that be a specific, like an oncology dentistry practice?
It is, yeah.
So it's very specific.
It's very specific, and her referrals come from medical oncologists.
Very interesting. It's good to hear. Great to hear. Great to hear.
She did her residency at MSK at Memorial Sloan Kettering, and is a wonderful teacher and colleague. I went and met with her just to say, like, Debbie, what should I be doing? And she's like, you're good. Let's give you a magic mouthwash just in case. Let's do this. Let's do that. And she's, there's great help out there. And like I said, I'm able to do a lot at this level, but it can get quite complex.
No, it's very interesting. It's great to hear. It really is great to hear because, with diseases like cancer, it needs to be fought on so many fronts. And every little bit helps. Every little bit helps.
Mm-hmm.
It's been a really interesting conversation. I want to thank you so much for joining us today.
Thank you for having me, Kathy. I love speaking with you.
Where can people look to find out more about your practice, inquire about, what you do? Can you give us some information that will lead people there?
Yeah, my website is flatiron.dental. That's it. If you type it in, it'll send you to our website. Contact information is on there. On Instagram, also Flatiron Dental. I respond to messages and I'm happy to help. One of the things that I'm trying to do more and more is mentor dental students. So happy to speak with anybody, especially, this next generation of providers, and hopefully give them some motivation to do some of what colleagues like me and colleagues like myself are doing.
Well, kudos to you. Congratulations for all you're doing and continued health for yourself as you travel along, as we all do our health journeys. Thank you so much for joining us. Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.